morning, everyone. Thank you for joining us here today at the Royal Alexandra Hospital. Late last year, we announced we are taking significant action to improve healthcare for Albertans and the frontline workers who work tirelessly every day to serve their patients. And I just want to give a huge shout out to all our healthcare professionals. They do an absolutely amazing job each and every day. Alberta's new Refocus system will be a unified provincial healthcare delivery system that centers around 4 priority sectors: primary care, acute care, continuing care, and mental health and addiction. Our goal is to provide Albertans with a healthcare system that works for them, one that prioritizes their needs, from finding a primary care provider to accessing urgent care without long wait lists, and having access to the best continuing care options and the mental health and addiction supports they need when they need them. Albertans want and deserve the highest quality healthcare system that we can provide. When we embarked on this particular journey, we knew that our efforts would only be successful if Alberta's healthcare workers, caregivers, patients, and families worked with us. We also knew that we would need to be transparent throughout the whole refocusing process. And in that spirit, I'm pleased to provide you with an update on the work that's been done to date. We have heard loud and clear that healthcare workers and Albertans want to be involved in every step of the refocusing. In response, we've been holding engagement sessions in every corner of the province. Our goal is to build a stronger healthcare system informed by Albertans and their experiences, and importantly, by frontline healthcare experts who have valuable knowledge of the current system and the challenges and gaps that exist. The response has been extraordinary, with more than 2,500 Albertans participating in person so far. And we've had more than 18,000 people who have shared their feedback online. As well, we've had 10,000 others who have participated in virtual town halls. Initially, we had planned to hold 43 in-person engagement sessions, but in response to the popularity and our goal of hearing from as many Albertans as possible, we have added 22 more sessions for a total of 65 in-person engagement sessions. To put this into perspective, this is one of the largest in-person public engagement sessions in all of Alberta's history. So far, several themes have emerged from the discussions. We've heard about the need for strong system integration to drive seamless patient experiences. More opportunities for local decision-making has also been one of the themes, and the need for more healthcare workers. We are committed to continuing this work and listening to Albertans to make the changes necessary to fix the healthcare system while maintaining high-quality healthcare delivery. In addition to public engagement sessions, we will have dedicated information gathering sessions this spring with Indigenous leaders to discuss the unique healthcare needs and challenges facing Indigenous, Métis, and Inuit people and communities within Alberta. I encourage Indigenous, Métis, and Inuit individuals, healthcare workers, patients, families, and caregivers to provide their perspectives and feedback to help shape the future of the province's healthcare system. The feedback we have received from the engagement sessions held to date has brought us to another decision: to provide more opportunities to engage with service providers and experts who serve continuing care clients. The creation of the continuing care organization will be aligned with the primary care and acute care organizations in fall of 2024. While this is a change to our initial timeline of this spring, we have also said one of our guiding principles is to be flexible in the work we are doing. So this adjustment will help strengthen integration and collaboration, This adjustment will help strengthen integration and collaboration across all organizations to support patient care. Meetings with continuing care stakeholders are being planned for the coming months to support this change. And as we continue this work, I look forward to collaborating with my colleagues, Minister Nixon in Seniors, Community and Social Services, and Minister Williams in Mental Health and Addictions, as we work to set up the 4 interconnected organizations. So healthcare touches the lives of every Albertan. Over the course of our lives, we will need to access a strong system that helps support our health and well-being and gives us the care we want and need where and when we need it. I want to thank all Albertans who have supported this transition so far. And I can tell you that I have been to, I believe, 26 of the 65 engagement sessions, and that engagement has been just exemplary. I just love interacting with everyday Albertans on this particular issue. In the weeks and months ahead, we will be sharing more ways that Albertans can be involved in this journey. With your help, we will build a refocused healthcare system that better supports the well-being of frontline workers and prioritizes the needs of patients. I just want to thank everyone who has participated. I genuinely mean that. These information sessions, whether you participated online, whether you participated in one of the virtual town halls, whether you came in person, you have and are contributing to making our healthcare system better. And I want to encourage you, if you haven't participated yet, to please participate in the other sessions that are coming. And we will be coming back and doing more work on engagement. We want to make sure that this initial engagement doesn't stop here. We're going to continue that on. And one of the ways we're going to continue on that engagement is we are going to have a new parliamentary secretary for health workforce engagement, Chelsea Petrovic, and I'm going to invite her up to speak right now. She has 13 years of experience as an LPN, licensed practical nurse, and she is uniquely positioned to assist us with this work. She will be a vital addition to our team as we continue to refocus our efforts now and into the future. So with that, I will call on Chelsea to come forward. Thank you so much.
Thank you, Minister LaGrange, for that warm introduction this morning. So thank you very much. I'm excited to be here this morning. I'm very grateful to the Premier for the opportunity to serve as the new Parliamentary Secretary for Health Workforce Engagement. As a licensed practical nurse with 13 years in experience prior to this role as MLA for Livingston-McLeod, I know firsthand about the dedication and hardworking people in the health system and the challenges and joys they face on the front lines each and every day. Engagement with Alberta's healthcare workers has been a key component of the health system's refocusing work right from the moment it was announced last fall. And I can happily say that I've attended 4 in my riding, and with this new announcement, I'll be attending hopefully 1 more and continue on through other areas of the province. It is so very important that the voices of our frontline workers, it's critical to understand what is happening with them on the front lines, what needs improving, and what patients are experiencing. In addition to assisting with refocusing engagements, the Premier and Minister LaGrange have asked me to build relationships with frontline healthcare workers and their associations on an ongoing basis. Alberta's government is committed to building a path and an environment that fosters engagement with healthcare workers so they can continue to feel heard long after the system refocusing work is completed. As we incorporate the voices of healthcare workers and their unique perspectives on patient care, we can build a health system that is the best that it can possibly be. Health outcomes for Albertans will improve, and they will have access to the care they need when and where they need it. I look forward to working with Minister LaGrange in the days and weeks ahead as we strive to strengthen the healthcare system for all Albertans. Thank you very much. And from here, I'd like to introduce Christian, the Manager of Governance for Covenant Health. Thank you.
Well, thank you very much, Chelsea, and thank you very much, Minister. The refocusing of Alberta's health system has brought together partners from across the province, from funders to service providers to frontline staff, physicians, volunteers, patients, residents, and family members. Everyone's coming to the table and voicing what's working well in the current system, what are the challenges, and how it can be improved. At these sessions, we hear about the incredible healthcare staff who go above and beyond every single day. We hear about opportunities for improvement in local and bedside decision-making, and we also hear about the immense pressures, challenges, and fears within the current system and during this transition. We applaud government for the largest public engagement in recent history and listening and actioning the advice and recommendations of local Albertans. Covenant is looking forward to working collaboratively on the implementation of advice brought forward during the sessions and transforming the health system together with a focus on holistic system outcomes where the patients and residents are at the core of all decision-making. I'd like to invite Kara, the Vice President of Rural Municipalities of Alberta, to the podium.
Well, good morning. And as I was introduced, I'm Kara Westerland, a Vice President for RMA, as well as a councillor from Brazeau County. Our association represents all 69 rural municipalities across Alberta, which is about 85% of the landmass. It's no secret that the current healthcare delivery model has not been meeting the needs in our rural communities. Issues with everything from EMS to health professional recruitment to temporarily closure of emergency rooms have combined to reduce healthcare access for rural Albertans. This not only has health and wellness impacts, but also community and economic development impacts. With this in mind, to this point, we are pleased with the province's bold approach to restructuring the entire system to prioritize improved access to all types of care. While much is still unknown about the new system, the province's willingness to dedicate resources to creating a rural-focused department with Alberta Health and engaging with rural communities in recent months leaves us optimistic that the new system will be delivered through a rural lens. We do hope that in the coming weeks there will be an opportunity for engagement specifically with rural municipalities, as many have innovative and unique local projects and initiatives, as well as solutions to fill gaps in provincial service delivery that could possibly be built into the new system. We look forward to the opportunity to seeing how these changes will ultimately lead to better health outcomes for rural Albertans and to stronger rural communities. Thank you.
All right, thanks everyone. That's it for our formal portion, and we'll now turn it over to some questions. So Minister LaGrange, MLA Petrovic, Kara Westerland, as well as Athana Mentzelopoulos from AHS are all here, and they're available for questions today. And just a reminder to media that we will be sticking to one question and one follow-up, and because we have a lot of you in person and on the phone today. So if you could please keep your question to that. If you have additional questions, please rejoin the queue and we will come back to you after the fact. And please state your name and outlet for the record. If you're here in person, please line up at the microphone. So we'll start with those in the room. First at the mic, please go ahead.
Hi, Julia Wong, CBC News. This is a question for the Minister and for Athana. I've spoken with a second family whose loved one was sent to the Travelodge Motel for care and then to a second hotel. AHS has been saying that patients make a choice in where they go, but one doctor we spoke with who works with these patients say there's a presumption these facilities and agencies are vetted and vouched for because they're coming from someone within the AHS system. Yesterday, Minister, you said Alberta Health and AHS do not have contracts with Contentment Social Services. So it begs the question, how are patients getting these options? I mean, are these agencies just coming off the street and offering to take patients out of the hospital? And are Alberta Health and AHS vetting these social services agencies?
Well, you know what I can say is what I've come to understand is that they were on a list. This particular agency was on a list, and the social worker, and I can let Athana speak to it a little bit further after I'm finished my answer, is that the social worker worked diligently over a course of a fair amount of time, I would say, to find housing for this individual. Ultimately, the individual chose the housing off of that particular list. But where I see a gap right now is how do these agencies get on that list? If we do not have, if we don't have formalized contracts with these individuals, if we in fact don't accredit them, then why are they on the list? And so those are the questions that we're asking. We're actually going to do a review of the list. I've asked my colleague, Minister Nixon of Seniors, Community and Social Services, to work with me on this, because this is very important that we make sure that whenever an individual has something presented to them as an option, that it is an option that we fully support. Athana, would you like to add to that, please?
I think just a couple things that I would add. First of all, the work that is done by social workers follows the medical diagnosis. And I'm not going to obviously speak to the personal details of anyone's file, except to reiterate that there is a diagnosis made that is associated with discharge that helps to identify what, if any, ongoing supports might be required. And there can be many paths at that point. And sometimes, and frequently in fact, there's an iterative process to try to identify suitable options. The nonprofit sphere is actually, there's a lot of different entities in the nonprofit sphere, and I think our folks do a really good job to try to stay aware of whether there's any issues, and they are combining that with, as I say, an iterative process. So like the minister says, we need to look and make sure that there's enough attention paid to the quality of the providers. But I would take this opportunity to say that having actually been able to look at the details and speak to some of the folks involved, they bring an incredible level of compassion and commitment to their jobs. And I think it's really important to not lose that in this conversation.
And sorry, this is just a quick clarification for that one question. And Athana, I'm hoping to get you at the microphone again. So were these social services agencies and these facilities specifically, have they been vetted by AHS when they are presented to patients as an option?
Well, I don't know what you mean by vetted. There's a lot of different providers of different types. There's even, oh, sorry, thank you. There's even market options. And so ultimately what we try to do is make sure that, and again, it can be an iterative process in terms of what might be appropriate. But we try to make sure that options are presented, and then ultimately individuals, again, it is related to the diagnosis. And right now we're talking about people who are assessed by frontline healthcare workers to be able to make choices on their own about where they are going after discharge. And so those options are presented, and ultimately the individual has a conversation with the provider and looks at that themselves and makes their own decision. That's the general framework. Now, I want to reiterate, the diagnosis can be different, and there can be different levels of care attached to that for individuals who are assessed from a medical point of view, that they are able to take care of themselves and make their own decisions. We try to support that with options, and we try to make sure that information is presented, but we don't endorse. I think the subtext of some of this is that we somehow are endorsing. We do the work to find out what is available in the same way that an individual might do so if they were looking for care outside of the hospital.
And all right, the only thing I would add to that is Athana didn't mention is that there's over 500, roughly over 500 discharges each and every day, successful discharges. This case is very concerning. It is very concerning, and I don't want to diminish that. And I do feel for the individual, if he felt he was going to a different level of care that he actually was getting, because this was obviously listed as a non-medical care housing. And my understanding is that was the assessment that was given to the individual.
Thank you.
And sorry, this is my second question because there was a clarification of the first question. So my second question is, I've previously asked, and sorry, this will be a question for, again, both the Minister and Athana. I've previously asked whether AHS will continue working with Contentment Social Services, continue to present it as an option to patients. I've been told that AHS presents it as a housing option. That's what you reiterated, Athana. But with everything that has happened, it may be hard for patients to trust information that AHS is giving them, especially if, as you say, AHS is not endorsing these options that are being given to patients as they're about to leave the hospital. So is AHS, and Alberta Health, I imagine, might have some thoughts on this, Is AHS going to continue working with Contentment Social Services, presenting Contentment Social Services as an option for patients?
I am actually working, as I said earlier, with Seniors Community and Social Services, because they have a breadth of knowledge of what the services are out there and the quality of the services out there. But that being said, this particular nonprofit agency that is providing non-medical care, non-medical housing, is actually not one that either myself in Alberta Health or Alberta Health Services or Seniors Community and Social Services is familiar with. So no, they will be removed off the list. And in fact, we will be reviewing the whole list that currently exists out there and making sure that those that are on that list, those vendors or those agencies, those providers, are actually ones that we can, because there is an implication that because they're on a list, that we have actually approved them. And I wanted to be very clear, I was very clear in all of my communications over the last couple of days that we have not accredited that agency. And so I'm not sure if Thana has anything more to add on that.
All right, thanks.
Okay.
Next to the mic, go ahead.
Thank you.
Shayla Skalski with CTV News. Just following up on my colleague's question, the Minister or Alberta Health Services, can either of you say how many Albertans are receiving care from Contentment Social Services at this time? Or housing?
I don't have those numbers. I'm not sure if Athana, if you have those numbers.
Could you just say the question again?
How many Albertans could be receiving care, or in this case, housing from Contentment Social Services? Just how big of an impact? Because you talked about one individual.
I just want to clarify too, because this is an outside agency, they're not necessarily all Alberta Health Services or Alberta Health patients. These are individuals that could have chosen this. They're obviously out in the public. They could have chosen this as a means of providing care or housing for themselves, just like you would look on a list and you'd go to you'd Google and say, I need housing, what's available, they would have popped up on the list. So these are not all necessarily individuals. I don't have a number. That's why we wouldn't have a number, because we wouldn't track that number. Athana?
And the only thing I would add is that many Albertans receive home care from us, and the relationship in home care is between AHS and the individual. So we would be providing those services regardless of where they live, if they qualify for such services. We don't establish that relationship with their housing provider. It's with the individual.
And then my second question for the Minister, as well as perhaps the Parliamentary Secretary, in relation to the announcement today. We've heard reports that as many as 126 Alberta Health staff have been terminated but presented with equivalent job offers from Alberta Health. Can you confirm the total number and how many of those have actually accepted jobs with Alberta Health? And then also, what is the province doing to ensure that that kind of instability in terms of the job market isn't deterring future frontline healthcare workers from coming to our province to work when we desperately need them?
So lots there to unpack. So when we introduced the refocusing, we said there would be shifts of individuals, some from Alberta Health Services into my department. The first tranche of these individuals were, I believe it was 126 that you mentioned. I had originally heard a number of 130, but then that has changed over time. We communicated with the unions early in December saying that there would be some changes, and we've been working with the union in this particular case. These are all non-frontline workers. They work in capital planning, systems planning, etc. Of the 126, they were all offered positions within Alberta Health, within my department. And we've worked again with the union. Actually, quite a large number of them are non-union positions within Alberta Health Services that actually will be going to union positions within my department. I'm not exactly sure how many have fully accepted. I believe the number is around 100 of those 126. The other 26, and I wouldn't say they were terminated, they were just offered positions, equivalent positions within my department. The other 26 will be offered positions, equivalent positions within Alberta Health Services, and I can have Athana speak to that piece. Those who choose not to then would have options in terms of as they would with any other employment. And so we would have red circled salaries to make sure that they get the same salaries, and then making sure that they have equivalent benefit packages, et cetera. Did that answer your question?
Yeah, the other part of the question was just in terms of what's being done to train. You said that third piece of your overhaul was to attract more healthcare workers. What's being done? It's been several months now. You're talking about the engagement,
Oh.
but how are we actually attracting more people to come here? And have you in fact attracted more?
We have attracted more people. We have hired over 7,500 nurses just this year alone. We have hired an additional 330 physicians across the province, and we're continuing to do that. I really want to have Athana speak to that because I know there's been a lot of progress in the last few months alone in that wheelhouse. We continue to work on salary incentives, workforce strategies. We have a rural health workforce strategy that we're continuing to improve upon. When I look at the work that we're doing with the Alberta Medical Association in terms of stabilizing family practitioners and bringing more family practitioners, first of all, retaining the ones we have, the excellent ones we have, but then bringing more to the province. We're looking on a new funding model. I've got the largest ever physician compensation package line item within my budget. It's $6.6 billion this year. That is an 8.3% increase from last year. We've got the nurse practitioners. We're very close. We've come to an agreement on nurse practitioner-led clinic funding, and so it's just a matter of the nurse practitioners getting the authorization from their members, and I'm hoping to have an announcement on that very soon. We're expanding seats across all our post-secondaries. We're doing great work, not just with healthcare aides, but nurses, doctors. So yes, there's a lot of work happening, and Alberta is the place to be, and we're hearing a lot of people wanting to come to Alberta and practice here, so.
Hi, Minister. Brianna Carson-Smith with Global Edmonton. My first thing is just really wanted to clarify, because we spoke with the head of Contentment this morning, who told us that they do home care and that they do use staff provided by AHS. So I wonder how that's possible without a contract. And then my question would be, we've gotten quite a few calls and emails from patients in similar positions, going to hotels, unaware of the conditions they would be going into, assuming that they would need or get more care. How many calls, emails of similar situations has your office received?
Well, to my knowledge, I haven't received any at this point in time, but I have a very big department, so it might have gone to others, and I'll check into that number and get back to you on that. I believe Athana spoke to this earlier, that while you have a contract for home care, it's with the individual, it's with the patient, it's with the individual who is now being housed. I find it totally unacceptable that someone would an agency would put themselves out there to an individual to provide them a service and not tell them where they're going to be housed. That's unacceptable. And that's why, from my perspective, this particular agency is being inauthentic and not transparent with its clientele, and why I would remove them from the list. Athana could speak more to actually how that works in terms of home care when it's provided to these individuals. So.
And does that mean that AHS staff won't be working with this company anymore then if they're removed from the list?
We don't.
They say that you do. They say they use AHS.
That's probably worth a follow-up conversation from us to them, because the home care is provided based on a relationship with an individual. And we provide those kinds of services to people all over the province in all kinds of housing circumstances. So I will have to follow up to understand exactly the way that they're portraying it, and potentially to ensure that they're portraying it in a factual way.
My second question is actually for the Parliamentary Secretary. I'm wondering how your belief that heart attack patients should take some personal accountability is going to play into your work in your new role.
Thank you for the question. I addressed that over a year ago, and I stand by that statement. My focus right now is to really create a positive relationship with our frontline staff and our frontline workers, and that's why the minister has brought me along, and that'll continue to be my focus going forward. Thank you.
All right, thanks. With no more at the mic in the room right now, we're going to go over to the phones. First on the phone, please go ahead.
First question is from Kyle Moore, Kicks FM.
Hi there. My question here is for Minister LaGrange. Certainly, while you've got all this work going on with the healthcare system right now, there are still a lot of issues with communities in our region having shortages of family doctors and emergency rooms being closed because of a lack of doctor coverage. What kind of things is kind of happening to help address some of the doctor shortages that we're kind of seeing up in our area here?
Well, as I said in my previous answer, is we are taking a multi-pronged approach. So, there are some long-term things that we're doing in terms of making sure that we are working with our post-secondaries. We will be announcing something very soon. I know I've budgeted for it, and I think people have heard about having some rural focus training within Lethbridge and in Grand Prairie. When that is fully functional, that will actually produce 100 rurally focused physicians. But we know that we have a physician shortage, not just in rural areas, but right across Alberta. And so we are very focused, particularly with family physicians. It's why I signed the MOU with the Alberta Medical Association. It's why, even though we signed a contract about 15 months ago with the Alberta Medical Association for physician compensation, it's worth about $780 million over the next 4 years. When we realized there's still an issue with family physicians, that I added an additional $257 million to stabilize them as we work through this new funding model that they would really like to see come into play. And so all that is in the background. We're also working with the College of Physicians and Surgeons to streamline their processes. They've been very good about shortening their assessment periods for internationally medically trained physicians, as well as right now, up until this March, only Alberta Health Services could sponsor a physician, a family physician. Now that has expanded so that clinics and municipalities, et cetera, can also sponsor. So there's many things that we're doing. As I said earlier, we have had an additional 330 physicians come to the province and set up practice. We definitely want to keep the ones that we have, and so we have retention bonuses, et cetera, et cetera. There's a lot of financial incentives that we're doing. We're also working with PARA, the Association of Medical Residents, to make sure that what we put in place attracts our new and upcoming physicians, that we're able to help them to get established and to also want to practice here in Alberta. So there's a lot of things that we're doing. We've been able to attract, as I said, more physicians. We've attracted over 7,500 more nurses. We're working on healthcare aides, increasing those numbers, and all of our allied healthcare professionals. We know there's a need, so we're going to continue to focus on this and make it a priority.
Kyle, did you have a follow-up?
Yes, and as a bit of a follow-up, I know one thing that has come out of some of these engagement sessions has been people wanted to get more opportunities for local decision-making. Is there, do you have kind of any idea as to what that could potentially look like down the line?
Well, I definitely will have the regional advisory councils, but beyond the regional advisory councils, we want to make sure that those advisory councils will reach down to the community. And so we're going to put structures in place that will mandate them to reach into the communities. I'm going to continue having these sessions, these engagement sessions. They've been invaluable. So many good ideas and just even highlighting the issues that we're having, but there's also some very positive things that have come out of it. And one of the positive things that I really want to stress, overwhelmingly, what we have heard across the whole province is that our greatest strength here in Alberta in healthcare are the people that are working in healthcare. And I just want to thank all of the people who are working in healthcare, because it's been recognized, and sometimes we only hear the negatives, but we have so many success stories and good news stories that we need to celebrate. And I've heard that over and over again. Let's celebrate the good. Knowing that we have to improve upon things, knowing that there are things that need to change, but let's not lose sight of the great people that are working in healthcare, the good that is happening, the expertise that we have here that doesn't exist sometimes in other provinces or other countries. Alberta has been and can be, again, a world leader in healthcare, and that's my focus. That's where I want to get us to.
All right, thank you. Next in the queue, please go ahead.
Thank you. The next question is from Michelle Bellefontaine, CBC.
Thank you for taking my question. I wanted to ask again about the situation with the lift at the hospital, right? So what we're hearing is that Contentment Social Services was on a list, and that you're going to be reviewing the list. Well, what I don't understand is, first of all, who compiles this list, and how did Contentment Social Services get on this list in the first place?
I will turn that question over to Athana if she knows that, in recognizing that Athana has only been there since December, and this list probably pre-existed both her and I, but I will turn it over to Athana. Thanks.
Yeah, I tried to reinforce with my earlier comments that there is an iterative process. So at different times there can be different options presented, and to the extent that that constitutes a list, I think it changes and evolves. And what I've learned as well is that with the social workers, they also have a community of practice, and they're sharing information. They're sharing feedback about what they are learning about different providers, so that as much as possible, what they know they can bring to individuals. You know, in cases, and the minister has said this, in cases where we find that a provider has not maybe followed through with what they committed to do, so that obviously has an impact on the extent to which a social worker will offer it, if at all, and that's information typically that would be widely shared. And in this case, obviously there will be even further review.
Michelle, did you have a follow-up?
Yes, thank you, I do. So you have this list. Nobody knows how it started, how it was created, who contributes to it. Like, it seems like anybody can be on this list. So what is it, like, what do you say to people out there who are, you know, have loved ones who are in the hospital, perhaps, and being discharged, and need housing? And so there's this list where there's just, I could go down to the hospital and put my name on the list. Like, it doesn't sound like there's much vetting going on here. So where does this list come from? Nobody seems to know where this list comes from. It's not AHS, it's not Alberta, it's not Alberta Health, it's not Community and Social Services. It's just nobody's taking responsibility for this. So who's compiled this list?
Well, I don't know who compiled the list, but I can tell you who's going to review it and who's going to make sure that from now on that those that are on the list are actually vetted by us in the sense that Seniors, Community and Social Services, who has obviously particularly around housing that falls within their bailiwick, that they will actually have eyes on the list, know who's on it, and can say that they know that they are, you know, an approved vendor, I guess, so to speak, because in fact, this is a service that's provided to individuals. If we were to discharge people without even giving them an opportunity to see what's out there, you know, we could say, you know, find out for yourself. But that's the whole purpose of community and social services, is social services providing those supports to individuals. And as Athana said earlier, you know, I know the social workers. I know quite a few social workers. They do a tremendous job. They really want to make sure that the people that are in their care are getting to the right spots. We all want that. We absolutely want that. We've now identified a problem that probably has existed for quite some time. But you know what? Now that we know there's a problem, myself, Minister Nixon, Minister Williams, Athana, we're all on it, and we're going to make sure that we clear this up.
Maybe I could add one thing.
Sure. Yes, please do.
In the question, there was just an important point that I wanted to illuminate, if that's okay. And you talked about loved ones, and I think it's really important to say that the work that goes on with social workers to support patients once they have their diagnosis and they're looking at their path out of the hospital, they engage with loved ones as well. And I think that's an important point to underline.
All right, next in the queue, please go ahead.
Thank you. Lisa Johnson, Post Media.
Hi, thanks for taking my question. Just to follow up on some of my colleagues' questions about this patient who was discharged to a motel. Minister, you said that patient chose that provider, but that doesn't really line up with what this patient has told the media that he was not expecting to go to a motel. He did not understand the details. So it sounds like you're saying mistakes were made by the social worker who was consulting with him. You're concerned about contentment services and the decisions that were made there. But I guess people would be wondering, why aren't you, the leaders ultimately responsible for AHS, taking responsibility for this? And can you explain the discrepancy between what you're saying about the patient choosing it and what the patient is actually saying?
Well, my understanding was, and still is, that the patient, over time, working with the social worker, explored many opportunities and many different providers for housing. And I just want to remind everyone, this is housing, non-medical housing. So this individual has received his course of treatment. He's in a hospital room, even though he doesn't need to be in a hospital room. And so now he needs the next step, which is housing. My understanding is there were many options provided. This is the option he chose. Now, I would have believed that any agency that is working with a client would tell them exactly where they're going, that they will be going to this home, they would be going to this facility, they would be going to this particular site. For the agency not to have told them up front that this is an actual motel so that they could actually make the decision to say yes or no, because some people do choose to live out of hotel rooms. But that's unacceptable. And so from here on in, we will not have that agency on our list. Been very clear about that. I'm not sure if there was more to the question that I'm missing here.
Lisa, I guess I'll just ask then if you have a follow-up.
Yeah, like I'm still not hearing who's responsible for this scenario happening, because if government agencies are providing this list to patients, it is ultimately your responsibility. I'm not hearing you take responsibility for that, but so if you want to expand on that, that would be great. But I also have a question about the announcement that you made today. Just to clarify here, you're saying the government is delaying the rollout of the new continuing care organization to align it with the other three new governing agencies for primary care, acute care, and mental health and addiction. My understanding was that mental health and addiction and continuing care were going to be rolled out in the spring. So can you please explain why specifically those are being delayed until the fall?
So only continuing care is going to be delayed to the fall to align with primary care and acute care. Mental health and addictions will move forward in the spring. We are bringing forward, I will be bringing forward legislative changes to the Regional Health Authorities Act this spring. There is work to be done, but what we really heard from people, because we are bringing new regulations have just come into force to support the Continuing Care Act that comes into force April 1st. Even though it was approved last spring, it comes into force. There is a sense from what we were hearing in the engagement sessions that we want to take more time. We want to engage with continuing care operators. They want to have time with the new regulations, with the new act, and make sure that as we set up the continuing care organization in the fall with acute care and primary care at the same time, that we have that good integration and kind of a seamless path between all three of these. And ultimately, because mental health and addictions will be already stood up, that we can work towards that. Does that make sense to you? So it really is going to happen in the fall because of what we've heard. And we committed to that all along, that we would be flexible.
All right, okay, we'll go over to next in the queue then.
Thank you. Catherine Krakowski, Alberta Today.
Hi, thanks for taking my question. So I'm wondering who is responsible for overseeing that standards are met for what you call non-medical housing? Because Minister Nixon yesterday said because there's no contract with that agency, it's not his department. And you're saying it's non-medical housing, so it's not health. So who sets the standards for these types of housing when it's a discharge from a medical situation?
Well, and that is what we have to dig into, because what I'm sensing here is a real gap. And it is the very reason that when we made the announcement last week for the $1.7 billion to continuing care to make enhancements, to make improvements, that we, particularly where it's concerning alternate level of care patients, that we put in place a cross-ministry approach, because I don't think right now we have that integrated cross-ministry approach. And so therefore there are these gaps in service. So what I'm saying right now is that's what we've committed to. We are going to make sure that we have the proper procedures, standards in place. Ultimately in housing, seniors, communities, and social services, but we also know that these are very complex patients. It's not just sometimes a housing issue, sometimes it's an addictions issue, sometimes there's mental health conditions as well. There's any number of factors that play into this, so we need all the ministries working together. I have been very vocal about a cross-ministry approach, even when I was the Minister of Education, because we see where we have to put the patient at the center of the journey, because then we can provide the right services, provide those right wraparound services to those individuals. And so that is the work that we are embarking on.
Catherine, did you have a follow-up?
Okay, so I'm hearing that you need more cross-ministry approaches, but today's announcement is talking about one of these agencies being delayed. How does creating separate mental health and addiction, separate continuing care, separate acute care, how is that going to ensure that they work better together?
Well, there's a lot of silos that currently exist within the system. And so we are keeping what is best of having one geographic health authority. The IT, the ability to procure, the data collection, those type of things. But what we want is sector organizations that actually are focused on their sector. Right now, Alberta Health Services is trying to do all the acute care, but it's also trying to do primary care. It's also trying to do mental health and addictions. It's also trying to do continuing care. It operates roughly about 28% of the continuing care, but holds the contracts with all of continuing care. So to have a sector that's actually focused on their own needs within that sector. It is something that we heard through all the engagements on continuing care. It's what we heard on the engagements on primary care, the MAPS, the Modernizing Alberta's Primary Care. We heard this, and so this is just refocusing it. And I want to keep going back to that. We're refocusing so that we can be focused on patient care. But there is an integration council, there is a need, and there is it will actually be mandated that these organizations work together, because again, putting the patient at the center of the journey, there's going to be the opportunity, because Connect Care right now as a province, we have spent $1.5 billion to bring Connect Care mostly into our acute care system, but it hasn't been available to primary care or continuing care or to mental health and addiction. And we need to have it accessible so that we have one medical record for a patient, that those who are dealing with that patient, regardless of what sector you're in, has access to that information for the patient's well-being. We know we have some privacy legislation that we're going to have to deal with and fix, but that being said, we have to do it. We have to make sure. So there is an integration council. There's structures that are going to be put in place to make sure that that journey is seamless. But to think that right now there aren't silos that already exist would be, inaccurate.
All right, thanks, folks. We're just going to do a quick pass back through the room to see if there's any additional questions, noting some time constraints here as well.
Hi, thanks for taking a second set of questions. So again, this will be for the Minister and for Athana. Between the two of you, you said you're concerned that this is unacceptable, that these patients were taken to the travel lodge, that these patients were taken to a hotel, but it doesn't seem like anyone is taking responsibility. And what I haven't heard is anyone apologizing or saying, I'm sorry. So is that going to happen?
You know what, what I would say is this is a terrible situation that has come to light. I am sorry that the individual at the center of this situation feels that he was, that the service that he was going to get was misrepresented to him and his family. So I know that going forward, we're going to do better because we have to make sure that the individuals that are served are getting what they need. So we can only acknowledge that there is an issue here that needs to be addressed. We've now been able to determine what that issue is, and we are going to go forward making sure that we correct what that issue is.
And Athan, is there anything you'd like to add?
No. All right, thanks, folks. We're just going to wrap up today because we've got to get the minister back to the ledge. So I just want to say thanks to everyone for coming out today. And if you have any additional questions, you know where to reach me, and we'll work to get back to you. Thank you very much.
Thank you.